Hi, it's Brian Thomas. Welcome to another edition of Rethink Healthcare Together. Most of the 55 KRC Morning Show, and every Sunday at this time, talk with John Ruhlman from Cover Cincy about a better way to get medical insurance. And it's beyond medical insurance, as we're going to find out. But he's been able to help individuals get medical insurance for much less premium and better coverage with sort of dollar one coverage. And you think, wait a second, there's no way I can get something paid for right up front. I've got deductibles, I've got co-pays. It does not have to be that way, as John has proven time and time again, as we've talked about this. I always find it just so fascinating what John and the team at Cover Cincy are able to do for folks because they represent you, not insurance companies. John has access to a couple of hundred different insurance companies with thousands of different policies. So he can package together multiple different policies and get you superior coverage while saving you money. Yes, he does it every day. John Ruhlman, it's always great talking with you. And you brought somebody with you today.
I did. I brought Kristen Bailey here with me today. She's from Sweets and Meats, one of our clients here over the last couple months. And it was actually a great situation. We met her through some local networking, mutual BNI representative that we actually have because we're members in the local area for networking. And it was actually funny because Kristen with her, we actually were trying to connect for a while. Right? I mean,
yep.
So we kept trying to meet and get together and get censuses for our employees. I actually saw her truck at the Oktoberfest. Like, that is the truck for the people that won't return our phone calls.
And that's why we weren't returning the phone calls.
Too busy making barbecue.
Absolutely.
I've been told, and I'll put a plug in, she did not pay for advertising. John covering this segment because, this is important for him to get this message out. Sweets and the word "and" spelled out, Sweets and Meats, bbq.com. From everybody's lips to your ears, the best barbecue in the city of Cincinnati. So say it, John Ruhlman. That's a bold statement, brother, and I cannot speak from knowledge on that one because you didn't bring any samples in this morning. So next time.
Next time,
or I'm
absolutely.
going to find the food truck.
That's
by
my
going
way to get back on air.
Anyhow, so let's dive on into another edition of Rethink Health Insurance Together. I should mention it's Cover Cincy with a Y or I.com because you're going to want to get in touch with John. Or you can call him at 513-800-2255. That's 513-800-CALL. It's worth a few minutes of your time to let John and his team work his magic to get you better insurance for less money, which is exactly why he brought Kristen in here to talk about what he did for her. So, how'd you meet, and then what did you end up doing for her that would have her come in on a Sunday to talk about insurance and Sweets and Meats barbecue?
Well, I'll let her talk a little about her background and struggles of trying to provide quality healthcare coverage. But, what we do a lot of our clients, our first initial intake will usually be a Zoom meeting. I know how busy all my clients are because majority of them are small business owners and self-employed. That's why I literally, make tens and dozens of phone calls sometimes to try to get in front of some of my potential clients. But eventually when we do, we try to do a Zoom meeting. We meet face-to-face, at least that way, start going over, what their pain points are and what they're trying to do. And then, we actually had an opportunity to meet up at her shop. And great shop, by the way. Problem that shop did not have a place that I can get food either. I literally walked in there. We were there for 2.5 hours helping all of our employees get set up, all individually done. And I'm like, I'm usually the one that cooks dinner. And I'm like, it smells great. I'll take some home. She's like, we don't have anything here. It's just in the food trucks. But I'll let her talk a little bit because she kind of shared with me a little bit some of her struggles she's had over the last few years of even trying to find anything.
Well, how many employees do you have?
So we have 17 employees right now, but in the height of the summer, we typically run around 23.
Oh, okay.
And we're getting ready to open a new restaurant, so we'll be adding employees. John should be excited about that, but we'll be adding probably another 10 to 12 employees.
Now, is it fair to say, because I don't know, but I know of businesses that do not provide medical insurance or offer medical insurance as a benefit for employment. And I would imagine a small food truck business probably be in the category of not likely to offer full medical benefits for their employees.
Correct. We're probably an anomaly. The majority of small business owners, especially in the restaurant industry, it's just almost impossible to get affordable insurance for your staff. We have tried to do it personally for the last 4 years, but until we met John, we just simply could not afford it. Our staff couldn't even afford it. Even if we were covering 60% of their premium, they still couldn't afford it. So we just helped them in other ways, going through like healthcare.gov, the Affordable medical plan.
Yeah.
But
Obamacare
it wasn't
thing.
until
Yeah.
exactly, and it wasn't until we met John and Amanda that we're like, whoa, there's other opportunities. Like now my staff has not only medical, but they have dental, and we provided company paid life insurance because that's something that's really important to us. So,
And this is a small business. We're talking a small business here. Now, when you're out trying to search for yourself for affordable benefits, I mean, did you just call insurance companies up? I mean, because I didn't understand the concept until I met this man that there are medical insurance brokers out there that work for you, again, like financial planners. Did you just like ring Anthem up or call up, whatever, Blue Cross Blue Shield or some other plan?
that's exactly what I did. I left corporate world before I became, a business owner. I worked in banking for 15 years. I was used to the corporation providing me with benefits. It, took all the guesswork out of it. I just got the money taken out of my paycheck every 2 weeks. As a business owner, it is so, so difficult. It's something I've talked to legislators about. It needs to be more simple. It needs to be affordable. With us trying to offer insurance to our staff, I can tell you how many of them go without insurance because they simply can't get it. You mentioned food trucks. I don't know any other food trucks that provide insurance. I don't know a lot of restaurants. You don't have to provide insurance to your staff unless you have more than 50 employees.
Mm-hmm. Yeah.
So most do not, simply because they can't afford it. And with wages being the way they are, costs being the way they are, it's just very, very difficult. We're very grateful that we found John because I'm literally paying less to provide full medical, dental, and life insurance than I would have if I just got medical somewhere else.
Yes, that is true.
That is true. See, this, my reaction every time is like, no blanking way. I just, he does it every time though.
And
That's
my
why
staff loves us. It's a retention tool.
See,
It's the right thing to do.
I know. See, okay, now there's somebody else out there going, wait a second, I could do this? I'm having trouble getting someone to just show up after 2 days worth of work because I know how young people are these days. They've got no sort of work ethic when it comes to loyalty to their employer. It's like, screw it. I'll just go work someplace else for a couple of days and I'm down the road. Not walking off the job kind of stuff. But if you've got really good benefits, that is someone who's going to want to stay because they know if they leave your company and they're employed in a similar fashion, they're going to go without.
Exactly. And John's got some creative ways even to create like an HSA account where you can put money into an account for your employees. Again, another retention tool where if they've got money banked into this account, are they more likely to walk away or stay because they've got money set aside that they haven't utilized?
That's a captive audience.
So it is a captive audience.
Well, I mean, I think she hit the nail on the head, right? I've looked at group insurance for years, and even for providing it for my employees, and it's outrageous. I mean, you're not getting into a plan under $700-800 a month, and as we know, the deductibles and out of pockets are just as high as a lot of the marketplace plans, and especially in the restaurant business, we know we're dealing with lower incomes. Most of these people qualify for huge tax credits, right? So they're probably on the marketplace. So the nice thing that we were able to do is just like we talk on the show all the time is the employer comes through and they're providing the gap coverage. They're providing the first dollar benefits. And it's so much more cost effective for the employer. But you have to remember too, most people don't even have $500 in their checking account. So
Right.
How is someone going to come up, even if you paying $800 a month for health insurance for each of your employees, they can't afford the $5,000 deductible. So they're just going to think, you want me crap coverage. Why am I working here?
Right.
You're providing me something I can't even use. And when I go to use it now, I'm going to be working for the next 3 months to pay off my medical bill. Like that's a terrible situation.
Yes, it is.
So, that's exactly what we did. We provided first dollar coverage. So she made that as her, benefit that she provided for her employees. She added on a group life insurance plan. That's such an underserved market for a lot of people, especially with people under 50,000. Most people don't even have life insurance. They're making less than $50,000 a year. So it's just those are necessities for individuals. And I mean, she even did the dental plan. I mean, that's a huge thing. People will use dental at least twice a year.
Yeah,
they probably won't even use the medical insurance, but they'll use their dental.
Yeah,
and it's a great dental plan. So that's a huge benefit. And coming down to it, I mean, she's spending. I actually have your averages here. I don't know if you realize what you're paying per employee. It's $234 a month. That's what she's paying for each of her employees. So about a little over $50 a week.
So she's getting them first dollar coverage with an individual per employee expense of $234 a month.
Yes.
That's amazing.
And that's about half of what she would have paid just for group insurance.
And what's the employee share? What do they have? Since she's providing this upfront insurance policy. Remember, we're talking about multiple different insurance policies
Absolutely.
here. And you looked at each of her employees individually, right?
Yes.
So each person might have a different set of policies covering them, but you got the share that's up front at $234 a month. What do they have? Like, give me an example of one of the other employees and how the whole package is put together.
Well, I mean, so there are quite a few of the employees. So we're going to look at the major medical piece, right? So that's the piece that the employer would not be paying for. Because again, if you offer group health insurance, now they can't get tax credits. So
okay, this is where the tax credit part
this is where the
comes
tax
in.
credit comes
Right,
in, right?
right,
So
right.
you know, this is where I'm saying in these situations, especially for food trucks, restaurants, you know, where you're dealing with, you know, incomes at 30, 40, 50 grand, you know, the individuals can qualify for pretty significant tax credits to offset the cost of their health insurance. They're going to do it anyway. But again, they don't want the $9,000 out of pocket. So,
No.
you know, when she actually emailed me yesterday that she wanted to add on an employee. So we're kind of in that situation right now where I'm like, well, how much are you paying that employee? Because I want to try to see if they qualify for tax credits. But I think we're at, what is she, like 23,000 or something like that? I think you told me.
Yes.
Maybe like a part-time 30-hour. So more than likely she'll have a zero premium marketplace plan. I mean, that's what we would look at because Kristen's going to offer the first dollar coverage to help offset that deductible and the copays. So she's going to have a great health package, but you know, her fee, which that employee's paying, is probably nothing or very little.
That's amazing.
And it's great coverage. It's not coverage that like you can't get any doctors that take this coverage. Like it's widely accessible. I have an Ambetter policy. I don't know if I can say that on air, but we've used Ambetter for years. We get it through the marketplace. John has hooked us up with being able to get that at an affordable rate. If you have kids, especially, you do qualify for different discounts based on income. And I can tell you from personal experience, we had a medical scare within our family, and that policy paid out over $150,000. So this isn't just cheap medical coverage where you can't find a doctor that's going to accept it. It's great medical coverage. So I'm providing that, and I can't tell you how good it felt as an employer when I have people that have been in the industry over 20 years telling me this is the first time they've had medical insurance. Like I had somebody
Holy
cry.
cow.
It was the very first time she had ever had medical insurance in her entire life.
Holy cow.
Like that's just astounding. And it's this industry. Like most people don't. They go without. It's a really hard, labor-intensive job. And people don't do it because they don't know what they don't know. They can't afford it. They don't have access. But people like John are really just flipping the world upside down by helping all these small businesses.
Look at that grin on his face. He's so happy with what he does every day.
He
I mean,
is.
I'm serious
You have
about
to
it.
be
And he gets
passionate.
I've had so many conversations with him off the mic and not doing the show and things like that. It's like he just loves going to work every day because he's putting smiles on people's faces that are in situations like what you're describing right now. It's really remarkable. So very low cost to you. You get employee retention. You get happy employees, which
And
is a great
healthy
benefit.
employees.
And healthy
Now they can
employees.
take advantage of preventative care, things that you take for granted. They can go get their teeth cleaned. They can go get a physical. They can get blood work drawn. The preventative is huge. Most people go without, and then by the time they get to a diagnosis, it's too late.
So
I would just say just keep employees. I mean, you're absolutely right. I mean, that's a huge. I mean, what's the cost for an employee going down? Like, especially if you're going to go do a big event and you got two of your employees have been suffering for a while. Like, well, I haven't gone to the doctor because now I'm worse off 3 days later. I got to call off.
Yeah.
That's a nightmare. I mean, I know what happens in my business, losing a couple agents, and we have booked
Right.
appointments.
Yeah.
I can't imagine a food truck where that person's making the food.
Yeah. Does this look infected? Yeah, it has looked infected
And
for the last
that's-
month and a half, and you haven't done anything about it. Now look.
And that's where we really come in with the education part too. So when we sat down and talked to each of their employees, like, listen, you're getting a great healthcare package. You do have free preventative, but I always tell them, like, you also have telehealth tied into this. You can talk to a doctor anytime. You don't have to take a day off from work because you're sick. You can call them at 3 o'clock in the morning and talk to a doctor, get a prescription on your way to work tomorrow morning. Like, there's huge benefits in that to just have the access to care and at an affordable rate. I
And
mean,
let me
that's
tell
what's
you
crazy.
what got them really hooked. So when John told them that when they go to the doctor, the secondary insurance through Manhattan Life actually kicks in, that they can get reimbursed for those visits.
Oh,
so like
yeah.
every time, I think it's like 8 visits a year, they can go to the doctor. They get a $75 check
Yeah.
for going to the doctor, for doing what they're supposed to do.
And most of them have like $20 to $50 copays. So it's literally paying the copay and then, making another $20, $30 in the backside.
Yeah. This is the part that's always just mind-boggling to me because my son has insurance through him, and his first trip. I hate to bring this up again, but when it happened, I was my mind was blown. He gets within a week or so of going to get his physical, he gets a check for a couple of $100. I think it was $230 because his doctor only charged like $110. The insurance had factored in up to $400 in reimbursement, and since he didn't go through it all, he got the balance. It's just like, okay, cool. He's like, I can't wait to go to the doctor again. Yeah, he's healthy. He hasn't been back since. But you did anticipate where I wanted to go, which is you sit down, your team will explain this, how the whole package works together. You do a little seminar, and I guess you did this for each and every one of Kristen's employees.
Yeah, we did it. We had them all sitting there in front of their counter, and we talked to them all about the concept of everything that's going to happen, because they all basically had a similar package as far as what we're doing. And then we sat down with each one individually, and we made sure that, if they have a doctor or a prescription, we made sure that the major medical plan that they picked up was specifically covering those physicians that they had, and making sure they had the lowest copay for the prescription. We don't want someone to be in a situation where they have a $700 a month medication that's not going to be covered.
Right.
So I want to make sure. So if her situation's getting better, I mean, somebody else could be Blue Cross or United Healthcare or Care Source. It doesn't, whatever plan that we need to put them in. And then, of course, there are some of her employees that have higher incomes and it might be very healthy. Then we'll even look at the private market. Because sometimes the marketplace, again, if you're not getting tax credits, can be extremely expensive.
Mm-hmm.
So we can always look at the private market for them too, which can also save them money.
Truly amazing.
And that's what I enjoyed. It's a custom approach. So he's customized plan for every single employee. And I can't tell you, I mean, he had a big hurdle to overcome just culturally. There were people that had never had insurance, even with us paying for it, and they had no out-of-pocket expense. They were saying no, because they're so used to being taken advantage of, or
that's a shame.
Yeah. And so John and I are like, no, this is like literally Sweets and Meats is paying for your dental and your life insurance. Why are you not taking it? This is even part-time employees. And they're like, no, I don't want it. That's okay. I'm not going to go. And we're like, what do you mean? So I was like,
walking
John,
away
please
from a
talk
pile
to
of
them.
cash.
I had like 15-minute conversations with people on the side, talking to them why they should have healthcare coverage. I mean, I've been doing this 19 years, and I do a lot of training of agents. I have agents all over the country. And I always tell them one of the hardest people to try to get insurance for is somebody that hasn't had it. And the longer they haven't had it, the less likely they are to even think that they can get it or it's unaffordable. They put all these mental blocks in front of them why they shouldn't have health insurance. And I'm like, she's right. I remember the employee. I literally sat there and I was like, you understand this is free. Like, they're paying for it. This is costing you nothing. You should take it. And just having that conversation. Well, I'm 28. So he's like, I'm fine. I was like,
He has 2 kids.
Oh, no.
He has 2 kids. And I'm like, 28 years old. I mean, I've had clients get cancer in their 20s. I had a guy just blow out his knee. He has an ACL for doing a pickup game of basketball at the local Y.
Hey,
I'm like, that's $25,000.
Accidents, bus
Exactly.
hits you,
Exactly.
You fall off a ledge. I don't know. I mean, taking a selfie, kind of like,
And that's
yeah, you need a
the
doctor.
worst. People will tell me like, I'm good. I have coverage through my car insurance. I mean, $5,000
That's
medical.
$5,000, right?
$5,000 medical. That's great. That doesn't even cover you walking in the ER door.
No, it doesn't. It doesn't. If you think that that's going to cover anything, you are sorely disconnected from the realities of the cost of medical care. So you make your employees happier, you get better retention, they're getting great coverage, so they're healthier people. There is no downside in this. And you also have the benefit, and I just want to see how it's worked for you, because one of the coolest things that he does, in addition to saving the money, which is number one, they iron out all the problems you might have after you get insurance.
You can share that because she just emailed me the other day saying she's running into a problem.
Yeah. So for the guy, like most notably, who's never had insurance, you finally convince him to go ahead and do it. And he's like, well, now what do I do? Well, go to the doctor and you'll tell him what to do, present the cards and everything. Well, what happens if that guy gets an explanation of benefits? And if you've ever tried to read one of those folks who aren't connected with them, they can be like the peace of God, passing all human understanding. John's team takes care of it. It's like, if you have any questions, call Cover Cincy. Don't call the medical insurance company. Don't call your provider. Let John and the team work it out.
Yeah, and he stands by that. Like, a lot of people say call if you have a problem, but then like you call and like they're not there to help you. His entire team, and they respond right away. I'm personally having that problem where a lot of providers aren't used to having secondary medical insurance. So I'm going to my physician, presenting that card, and they're not running it. So they're not billing the secondary. So I'm not able to take advantage of that benefit, but they've been able to help me with file claims so that I can get reimbursed. I also have additional employees. As I said, we're expanding. So as I add employees, I can call John or Amanda or somebody at the office personally. They take care of it. They respond right away. You're not having to wait on hold from somebody from a foreign country. Like, you're getting somebody live that's from this area that's willing to help you and your staff. And the nice thing is, for me as a business owner, he mentioned that they had to hunt me down. It's not that I didn't want it. I was just so busy. Anytime I have an issue now, I have somebody, I just email them. I email them all the information. I give them the name. I give them the phone number, and then they handle it. Like, I don't have to be the go-between. I don't have to lasso my employees. Like, they're just taking care of it, which is amazing.
The customer service angle is outstanding, isn't it?
Absolutely.
It's just amazing to me. And you can't outsource this kind of knowledge base to Punjab. You know what I mean? Your folks have to be very knowledgeable.
There's no AI system yet for my care team.
Exactly. So, yeah. And then there's the acquiring the provider component, because, for example, my son getting that check back was because he went to a provider that didn't charge, like, say, $400 for the physical. So you can call John and they'll say, "Now, if you here's a list of great providers, and if you're trying to maximize your return, this guy will do it for X, and we recommend him," and they'll steer you in the right direction in terms of which providers you can go to.
Now, I have something that's going to sound funny, but it's quite serious. We have people saying, "Oh, I'm going to go get a colonoscopy." Like, over 50, you should get a colonoscopy. Nobody wants a colonoscopy, let's be honest.
Yeah, it's true.
Talking about that on air.
Been there, done that.
But they're getting a check back for going to get it, and they're like, now they're going to go get it. They should be getting it anyway, just preventative. You know how many people, I know people that have colon cancer at 50, that before 50, honestly, but they're just not getting these checks. But it's just an added benefit. They're like, oh, I can get paid to go get a breast exam. I can go, get a mammogram and actually get money back for that because I went and did it. So it's legal. I promise you it's legal.
Isn't it funny? You feel like you need to say that? It's legal. The companies know that they're doing this.
Well, we talk about the bait and switch, right? Because colonoscopy is, I think, the biggest bait and switch situation out there, right? You're going in for the colorectal exam. You're thinking you're going in there for preventative care. And then all of a sudden they find a polyp. So as soon as they remove that polyp, it knocks it into a diagnostic charge. So now it's going against your deductible. So, like, you're literally in what they call it twilight, right? You have no idea. You're thinking it's free, and then you walk out, it's $3,000 out of your pocket because the preventative care is now kicked out as diagnostic, so it's going against your deductible. So, most major medical plans, especially if you get something through the marketplace, the actual colorectal exam's considered preventative care, so it's free. Well, if it gets knocked out, that's where the secondary coverage comes in, because they're going to pay thousands of dollars, a first dollar benefit, for that situation. So if it is end up being, a diagnostic, more than likely you're not paying anything out of pocket. And then if it ends up being preventative care, that secondary coverage still pays. So that's what she's talking about, where it's literally paying thousands of dollars for you to get a colorectal exam, or hundreds of dollars for a mammogram or a physical. I mean, you're literally getting incentivized to get preventative care done, which I think is very smart.
And at a day and time where you just had a pandemic, people that were hospitalized with COVID that did not anticipate that. It also includes hospital stays. Yeah. So somebody that's maybe low income, that would be devastating. If you have a hospital stay that's hundreds of thousands of dollars, you can't come back from that.
No, you can't. And, the other component is, and I just read an article just the other day on the morning show about all these rural hospitals that are shutting down. A lot of people use them as their primary care. They just show up, and many of them can't pay, and the hospital, under a lot of situations, is obligated to treat them until they're at least stable. The hospital's out of money. They don't. It's a loss.
I have a 4-stage approach to hospitals. Right, first line is telehealth. Second line, go to urgent care. Right, and third line, go to your primary care, and then fourth line is emergency room. You shouldn't be going to the emergency room ever unless you think you're dying. I've literally watched insurance companies decline claims because they go, it's not life-threatening. Imagine that, going into the emergency room, and even if you have a $500 copay, and they turn around and go, not life-threatening, we're not covering that bill. I've watched major insurance companies do that. So you got to be very careful. And that's why I think having multiple levels of coverage, so that you have access to immediate care, that you have access to those things. And if we're doing the right things and building the right plan, you're getting paid for the urgent care too. So we want to incentivize you to stay out of the emergency room and run up thousands of dollars. So that's really our goal.
That really is great. And people would be beating down your doors to talk to you now that since we've had Kristen's wonderful experience as a small business owner who actually can afford to make her employees very happy and healthy by getting a medical coverage. And like you said, dental and life. Cover Cincy with a Y or I.com. Cover Cincy. It's a 513-800-CALL. I keep wanting to call it an 800 number. It's not an 800 number. It's just 800-CALL.
Say 800-CALL,
513-800-CALL. You got to say area code these days because, I got friends that have cell phones. They move from like Cleveland or something. They keep the local area code. It's like, who am I calling? Anyway, 513-800-CALL. Well, just got an incentive for people to give you a shout there, John, and the team at Cover Cincy, and I know she's happy and a great illustration of what you're doing each and every day. Now, up to, it's 50 employees?
Yeah, so anything over like 51 employees up is where you have to provide group benefits, so you start actually getting penalized by the government. What I would say for a lot of individuals, especially the food truck or any restaurant, is we should have a conversation because it's not always about, oh, I think it's going to be too expensive. When I really went in with Kristen, my goal with that was, what would you want to pay per employee? What could you financially do? And then I will absolutely build a plan.
Oh, no kidding.
Specifically based upon that. So she had a budget, and we built a plan right around that.
Wow, that's an angle that I never even thought about.
Yeah, and we can do it literally as one employee, 2, 3, 4. I mean, it doesn't really make a difference. I help groups over 50 all the time. We do group insurance on that side too, but my bread and butter right now is really trying to help the local businesses they're the small ones. They're the ones getting creamed by raising inflation and costs and all that. If I can show them a better way to rethink their healthcare, I mean that's my goal. That's what gets me up in the morning.
Yeah, and I'm just thinking you could actually have people then who really want to do that kind of work that aren't inclined to be drawn to it or do it. The social interaction, the fun. You're always at a different location, moving the place around. You're sure, people at parties and people really just falling in love with your barbecue. That sounds like a fun job.
Awesome.
Yeah, it sounds like a lot of fun, but I can absolutely see someone saying, yeah, but I'm not going to make enough hours to cover, and I got kids at home.
You gotta have stability.
I gotta have coverage, so I'm going to go to do that mundane office job and do the 9 to 5 thing because they're offering me benefits, which benefits probably suck.
And it's right now, more than ever, everybody's looking for benefits. Like the return to the work office, like people are taking jobs based on the benefit package. And a lot of people have left. They've exited the restaurant industry, but this is a way definitely to get some of those folks back who love the industry, but for stability reasons, they had to find something else.
Well, be ready to hire some more people because people find out about Sweets and Meats Barbecue, which they can find online at sweetsandmeatsbbq.com. She's hiring.
And we have benefits.
You get benefits. Thanks to John Ruhlman and the team at Cover Cincy. Cover Cincy with YRI.com. Learn more, fill the form out, get the ball rolling, and John will get back with you promptly or call him again at 513-800-2255, 800-CALL. It's been a real pleasure meeting you, Christine. I can't wait for the barbecue. Next time.
And can I say one thing to your listeners?
You can.
If you're listening and you have a favorite restaurant or food truck, tell them about John.
Oh.
That is definitely something that would help them out. We don't know what we don't know. We're so inundated with the day-to-day with our business that we have no idea that this is accessible. So please, if you're listening, tell them about John.
Public service announcement to your fellow food truckers. Get your people coverage that you can afford, and it'll make them all happy. Wonderful closing message. Kristen, it's been a real pleasure. John, you and I will talk again and for another episode of Rethink Healthcare Together.